one thing as in accidents and assaults in OD means to prevent the patient and the nurse and the staff, and we have to educate how to prevent the patients and themselves from the hazards and the accidents that can be happen in the OD. And the definition: prevention of OD accidents and hazards affect the implementation of safety measures, aseptic techniques. Aseptic techniques. Does anyone know about? There is a word can like meaning.
Aseptic techniques. So Vinit is asking you to tell the meaning of aseptic techniques. If we got one of you stand up and tell. Anybody can stand up and tell. You can ask somebody. If volunteers are not there, you can ask somebody to tell. Name them and tell. Somebody. Volunteers.
Okay, that is a procedure which is accommodated by all the Indian Nursing Council and the which is followed by the Indian Council of Nursing. The technique is full of
measures that is being taken to prevent the action of transmission of infections. Yes, it's measures. These are the measures taken to control the spread of infections. Whatever comes under this category will be called as aseptic techniques.
Okay. And it's having a standard protocols of all the hospitals and the rules and regulations taken over by the hospitals. It is used to avoid injuries, infections, and equipment failures, such as PPE equipments. They are have to check over the equipments while before using to the voting theatre. Then make a standardize using of then fire accidents, then the chemical and electronic hazards like solutions such infections and chemical infections over the body.
Even filling of chemicals. Yes, filling of chemicals.
Then the blood samples, blood-oriented disorders can be happened. Electrical hazards in operation theatre by using the electronic substance for operating operations or surgery. We have the disorders. And why should we avoid accidents in OD? அதாவது நம்ம எதனால வந்து ஓடியில் வந்து ஆக்சிடென்ட்ஸை அவாய்ட் பண்ணணும் அப்படின்னா டு ப்ரொவைட் பேஷண்ட் சேஃப்டி. ப்ரைமர்லி நம்ம வந்து we should give the full and complete protection to the patients firstly. So we should protect the patients and maintain sterile environment. Accident may happen while we are not supposed to do the environmental clean or the maintaining of the stage of environmental clean for the operations, and ensure safety. That means the PPE or personal protective equipment. While the operation theatre, the surgery is done by the physicians, but the nurse should have all the personal protective equipment for take self-care and to avoid the cross infections from the nurse to the patients. To reduce medical errors. Medical errors while using pre-operative list taken for the histories and the data from the patient. We should mark it as a correct example for the signs. The patient having right something
eye surgeries, right cataract surgeries, right eye surgery.
such as the surgery area should be marked as which is located exactly, and now itself the hospital and the management are using some identification mark to access it. Otherwise, the medical errors may be happen in the OD also. To promote the safety function.